Welcome to Consulting Chike and welcome to another video. This is a series of implementation. So we'll start with NABH full level. So this will be in two videos. This is the first part. So part 1 of 2, and next week I'll release the second part. So please like, comment and subscribe and hit the bell icon to get notification of any new video. So let's dive in. So these are the contents. So in this first part video, we will be talking about the overview. Then we'll talk about committee meetings. Then something about infrastructure. Then about documents. Then forms and format. The licensing part, statutory compliances. And then MOUs. Then in the next video, we'll talk about HR trainings, emergency codes, incident reporting, quality indicators, certain reports, audits, and recurring activities. So do not miss any part of this video. Please watch this video till the end. Okay, so let's start. To give you the overview of NABH implementation, there are 13 main aspects of NABH implementation. So to start with, the first thing is committee meetings. Committee, as you know, there are about 16, 17 committees, and you can also club these committees. Committees basically help in driving the improvement initiatives. Infrastructure, so the hospital, it needs to maintain certain infection aspects. Then certain patient-centric things are there, and safety aspects during emergency cases are also there. So for these things, your infrastructure is required. Documentation, you have manuals, SOPs, your policies. And then for forms and format, you have checklist, certain assessments, sheets, consent forms, registers, those documents where you need to write, okay, the running documents. Then your statutory compliances, your licenses and certificates that is required, that you need to upload while you apply for NABH. Then comes MOUs. MOUs for outsourced services that you take, like it can be housekeeping, security, etc. HR and training. So here you have employee files, what things you need to maintain in the employee files. Then certain HR compliances that you need to do. Training requirements for the staff. Training requirement is something, it's a huge subject. Then comes the emergency codes. So emergency codes are basically certain protocols where there is, in case of emergency, what you are supposed to do. Like there is code red for fire, code blue for medical emergencies, like that. Then you have incident report. Incident report is something that will actually increase, basically improve the quality of the hospital. This is something that will go beyond the standards. So there are 4 kind of incidents, like near miss, no harm, adverse event, sentinel event. Then you have quality indicators. You have 32 basic quality indicators and 18 as per the scope of services, medical scope of services. Then you have certain reports that you need to do, like quality projects report, your quality assurance programs that you do, water testing reports, like that. Then you have audits, audit like clinical audit, active passive audit, nursing audit, prescription audit, NABH audit, the whole NABH standard audit. Then you have recurring activities. Recurring activities are basically list of activities which needs to be followed periodically, in monthly basis, quarterly basis, half yearly or annual basis. Now let's elaborate. Okay, so we start with the committee meetings. In committee meetings, it is very important that you maintain the committee meetings. You do the committee meetings periodically without fail, because committees are the groups of people who will actually drive the quality initiative in the hospital. So for committee, you have your committee TOR, and then you have your committee minutes. Okay, so all this needs to be taken care by the committee secretary, and the chairman plays an advisory role. Then infrastructure. Infrastructure, there are several aspects of infrastructure. Here, what you're doing is, so basically there are three aspects in terms of infrastructure. There are several cases where people say that as per NABH standards, as per NABH standard, but you will not get those point highlighted in the standard. You have to read in between lines. Okay, so for example, there is nowhere written that you must have a ramp, but operationally, it is very, very essential. So never skip ramp while you plan a new hospital. Um, Infrastructure wise, you have the infection aspects where you need to take care of your OT, CSSD, your ICU, certain places where you have where you need to maintain negative or positive air pressure, those places. Okay, and what do you do in kind of cases of emergency, like for code pink you need to have a secured place where in those cases you can just close down the whole campus. Documents, you have manuals, SOP, policies, manuals like infection manual, your nursing manual, HR manual. Those are big documents. And then you have your SOPs. SOPs are like department wise. Your emergency SOP, your IPD SOP, OPD SOP, your so department wise. You can physiotherapy SOP like that. And for policies are basically segregated as per the NABH chapters. So you have a set of policies for ASE, set of policies for COP, like that, chapter wise. Statutory compliances, there are basically 30 statutory compliances. We'll discuss about that one by one. So without those statutory compliances, you will not be able to even apply. So these are very important ones. MOUs, of course, for outsourced services, you need to have a proper MOU. We'll discuss about the contents of the MOU. HR trainings, HR and trainings. So like I said, employee files, you have to maintain employee files even for the contractual doctors. Okay, in many places you skip on the skip maintaining files for your contractual doctors. For doctors specifically, it is very important, otherwise you will not get the scope of services in your NABH certificate. Okay, so the NABH auditor, they come and they grill and see whether those doctors are there and whether they are enough to give that medical service. Okay, so that is a very important aspect of HR. Trainings, obviously it is very easy to get NCs for trainings. Okay, emergency codes, you have different codes. You have for entry level, 3 codes are mandatory: blue, red, and pink. And it is basically very important, as per the need of the place, you introduce certain codes. Okay, so in certain places where there is a chance of disturbances, you should have code violet, and in certain more disturbing places where there's a chance of bomb threats, you should have code black. And then incident reporting is something that will actually benefit the hospital. You just need to ask one question to any hospital which is NABH accredited, how many near miss incidents are you reporting? So if you get the answer as 0, that means the hospital is actually not doing much about improving the quality. Okay, because near miss incidents must be reported. Okay, this is one trick where you can actually assess how much improvement they are actually making. Then you have quality indicators. There are list of quality indicators. We'll discuss about that. Then we have certain reports. So NABH says you need to do at least 2 quality projects. So you need the report for that. You have several quality assurance programs running across several departments. Then you have your water test report and some infection reports. Several reports are there, which are all required. Then you have your audits. Audits is something which will keep the quality checks alive. Okay, so from audits, whatever you find from the audits, you discuss those in the concerned committee. Okay, for improvement. So without the audits, without the committee discussion, there will not be any actual improvement. Okay. Then recurring activity. Recurring activity is something that I've devised. So what happened was during my all this years of experience, I had found out that we would ask somebody, the concerned department, to do something. Then after 2 months, 3 months later on, when we go back, then we would see that they are not doing those. Certain audits are there, certain checklists are there, like facility round or your patient safety. So those needs to be monitored on monthly basis, whether those are done or not. So recurring activity checklist is very important. Okay, now let's do more elaboration. So committees. In committees, you have basically 17 different committees, and each committee will have its different TOR and MOM. What you can do is you can try to club these committees, no problem. So risk and safety can be clubbed. So likewise, you can see which committees you can club. But committees like POSH, blood transfusion, your code blue, your disciplinary, drugs and therapeutics, ethics, infection control, medical records, mortality, morbidity, these should be kept separate. Also the quality and management committee. Okay. Then you have the decisions. So the decisions shall be taken by the committee. So first you implement the forms and formats. Then those forms and formats needs to be converted into. Then those forms and format will be assessed through the audits checklist, and the findings of those needs to be discussed in the committee. But that doesn't mean that you will wait for all those things to happen. You need to discuss whether those things are implemented, whether those things are you're getting those datas properly or not. So the committee work should start from day one. Okay. Then committee basically drives all initiatives of the improvement of the whole system. Okay. Then you have then the committee basically monitors the activities, they discuss, they guide, and then again they monitor, and then discuss, then they guide. So the improvement cycle is it goes on and on. Okay. And the respective secretaries, they are responsible to drive all functions, and the chairman, they play an advisory role. Okay. So POSH committee we have, so POSH is basically for resolving any sexual harassment complaint, whether those complaints are genuine or not. And if it is proven genuine, then as per the POS policy, actions will be taken. Blood transfusion. Blood transfusion is to monitor blood transfusion reactions and whether it is being reported to the hematovigilance program of India or not. So that is solely discussed in the blood transfusion committee. Clinical audit. They need to plan, execute, and discuss about clinical audits of all medical departments. So whether those departments are doing clinical audits at least once in a year or not, that needs to be taken care by this clinical audit committee. And they also need to discuss about the findings of the clinical audits, how it has improved or how it can improve more. Those things need to be discussed in clinical audit. Code Blue. Code Blue is to discuss and improve response of medical emergencies, especially the BLS, your cardiac heart attacks emergencies. So everything about the episode of Code Blue is recorded in a Code Blue running sheet. So there, as per the sheet, those things will be discussed where certain improvements could be made. Okay, or any failure in Code Blue, that also needs to be discussed in Code Blue committee. Then you have condemnation committee. Condemnation committee, they decide condemnation of assets. The biomedical engineer plays a vital role here. So the biomedical engineering department, they suggest whether these equipment still can be used for spare parts. Okay, so those discussions are required. Financial department, they also need to be part of this condemnation committee. Disciplinary, to take disciplinary action against staff when required. So whenever you see certain staff has misbehave and certain disciplinary actions are required to be taken against staff, then this disciplinary committee acts. This is also related to the grievance. The difference is in grievance, a staff raises a grievance. It is taken into consideration through several steps. So when a person is found guilty, then the disciplinary committee, they take decisions on that. Grievance committee, their work is to assess the grievances, and any disciplinary action that needs to be taken against any staff where there are several witnesses and they have seen. For those cases, the disciplinary committee will take actions. Drugs and therapeutics. So any kind of ADR management, reporting of ADR, formulary making, implementation, narcotic drugs handling, all that seen by Drugs and Therapeutics Committee. Grievance, I have said. Biomedical waste management. So to discuss on issues related to biomedical waste, it's segregation, handling, transportation, storage and licensing part. Any issues pertaining to BMW discussed here. Ethics. So to discuss any ethical issues pertaining to research of clinical dilemma pertaining to research or clinical dilemma issues. Certain issues like DNR, do not resuscitate. So those things needs to be discussed in ethics committee. Infection control, it is to maintain high level of infection prevention in hospital. So the findings of infections through the quality indicators, via the quality indicators, are all discussed here. So any case of infections that had happened, any needle stick injury that had happened, hand hygiene compliances, those points are discussed in infection control committee. Then you have medical records committee. So the findings of active audit, passive audit, nursing audit are all discussed in medical records committee. Also, there's a part of prescription audit that also needs to be discussed here. Mortality morbidity committee. Here, it is to discuss on death cases, certain Apache score, where, say for example, the Apache score was very high, but um, the ICU department, they were able to save the patient, or vice versa, the Apache score was very less, but the patient was not saved. So those cases needs to be discussed in mortality morbidity committee. Then risk management. So anything that is found through the HERA checklist assessments, facility round checks, there is a changed probability of changed chance of hazard. So those risks needs to be discussed in risk management committee. Okay. Then you have safety. Safety, it is to discuss various safety issues found in patient safety audits or any other kind of incident, any kind of safety issues found through the incident reports. Okay. Then for quality, you have the quality committee. So the quality committee basically oversees every committee work. Okay. They compile it, they discuss about it, they talk about the quality indicators, the incident reports. Okay. The quality committee's meeting is to basically compile all those points and then select points where the management's intervention is required. Okay. And then the quality team presents it in the management committee or the apex committee. Okay. So this is how the whole committee work functions. So in terms of infrastructure, you have the fire compliance part. So there are fire compliance laws that needs to be followed. Okay, which has to be supported by the signages. Then you have your departmental infrastructural requirements for OT zoning, for OT the zoning, your CSSD layouts, your emergency layout, kitchen, ICU, histopathology, specifically histopathology for lab, and then you have the chemotherapy. Here you should not compromise. Okay. Then you have how the emergency codes can be implemented, especially for code red and code pink. And then the patient accessibility, privacy, those aspects are also seen in terms of infrastructure as per NABH. Okay, now let's go deep. Fire compliances. Fire compliance, in case of fire, you should have a separate staircase alley where you can completely close that. So for example, one floor is having fire, and through those fire doors, because of those fire doors, the fire has to needs to be contained, so that particular that particular staircase can be used. Say for example, in second floor you have fire. From the third floor, the people should be able to go down using the same lift, same staircase. So the fire needs to be contained. Okay, and there are several other fire compliance points that needs to be taken into consideration during the designing of the hospital. Okay, then you have your departmental infrastructural points like OT zoning. So how the patients are going inside the OT, how your staff they are moving, how the biomedical waste, your items, those are moving. Biomedical waste should not have a crisscross movement. Okay, those things needs to be considered. CSSD, used items, wash, sterilization, storage, and then it goes. For emergency should have proper beds, proper area for triaging. In case of mass casualty, how those four categories of patient will go. Those things needs to be taken care of. In case of kitchen, how the used utensils are moving. It should not have it should be a unidirectional flow where the used utensils are not crossing the path of the food which is cooked, okay, or the storage area. It should have a unidirectional flow. Histopathology, the grossing area should be separate from the histopathology lab, and it should also have a proper hood. ICU I missed. ICU, you should have a proper plan of ICU where you consider the aspects of infection. So, say for example, in isolation, I should not have a crisscross movement with the patient which are there in ICU. Okay, so in isolation, you you admit those infected patients so that they have to be kept separate, and the isolation room should have a negative air pressure. Yeah, and then you have chemotherapy. So how you prepare the chemotherapy medicines, how it is being taken to the chemotherapy ward, and how the doctor they sit in the chemotherapy place. Those design needs to be made properly. Then you have emergency codes in case of red, like I said, in case of fire, how it is dealt with. Say in case of ICU patients, how the ICU patients are taken without using the staircase. So in case of certain hospitals which are very old, they don't have a ramp. Now the ramp part, the ramp part I'm saying, it is not written anywhere in the NABH standard that you must have a ramp. But practically it is not possible to evacuate. It's very, very difficult actually to evacuate patients who are ventilated using the staircase. So for those, ramp is very, very important. Then for Code Pink, you need to have a closed infrastructure. The whole campus should be made in such a way that you can close all gates. Okay, when there is a child theft, the kidnapper is running away. So in order to prevent that, you must have a closed campus. Okay, then for patient, your accessibility, how certain patient who are in wheelchair, how they are coming, they should have a proper differently abled assigned toilet for them. You should have a play area. You should have a breastfeeding area. Okay, and the privacy issues where in case of sample collection, it should be closed. You should have a curtain rail in your IP areas, emergency beds, basically. Okay, so these points are taken into consideration as per NABH. But other infrastructural aspects during design of a hospital is taken solely on the basis of the operational part. Okay, operational sense of the hospital. Other points are taken. I may have missed something, but this is more or less to cover the NABH aspect of infrastructure. Then we have documents. In documents, we have manuals like HR manual, your infection control manual, nursing manual. SOPs are department wise, OPD SOP, IPD SOP, all mortuary, your physiotherapy, like that. So department wise, your obs and gynae, pediatrics, like that, your SOPs. Policies are basically standard wise. So AAC, COP, FMS, like that. Chapter wise, you have folders, and in each folder, as per the standard or as per one or multiple objective elements, you will have different policies inside the chapters. Okay, then you have a coding system. So for the coding system, I'll tell you about this concatenate formula. So now let's elaborate. So here, as you can see, there are two kind of coding system I have showed here. So say for example, it is the manual, or even if it is an SOP. So in this case, you need to have a Excel sheet where you make these columns. Your document, you can also put a serial number on the left hand side. Then you start with the document name, the hospital code, your document type, your department, your name initials, numeric code, document code. So here there's an example of infection control manual. So if you have an infection control manual, you will have it like AIMS. Say for example, this is for AIMS Guwahati. So AIMS Guwahati, your hospital code, you can see here AIMS -GHY. Then you have MAN for manual. Then you have the department HIC. Then you have the initials, infection control manual. Here it should be ICM actually. Then you have the numeric code. Okay, so to arrive to this automatically, you just need to put this in your cells. And say for example, this is A2, this is B2, C2, D2, E2. So you have a formula called concatenate. So in Mac it is concatenate I think, and in Windows you have the formula as concate. So you just check. Okay, so you need to put in this column document code, you need to put equal, then write concate or concatenate as per your system. Then you start the bracket. Okay, you start the bracket, and then you write A2, that is this, and then you put a comma, and then inside double inverted comma you put a slash like this, and then put a comma, and then you go to the second cell. So this way you can make the whole, you can go to till A, B, C, D, E. Okay, and then close the bracket. Once you enter, press enter, you will have the whole document code made. Okay, only in case of SOP will have the same kind of format. Only in case of policies, which has to be categorized as per the chapter. Here instead of department you use chapter. Okay, so similarly you can do it. Then we have our forms and format. So forms and formats. You have the assessment forms, you have your checklist, you have your consent forms, you have other kind of forms, you have your registers, then you have a coding system. So in coding system, I'll elaborate about this. Uh, what you need to do is you need to have a Excel where you write about the document name, the hospital code, document type, department, alphabetic code, numeric code, and then as per this formula, you arrive to a document code. Now let's elaborate. Assessment forms can be like initial assessment, your initial assessment for doctors, for emergency, for nurses, all those documents that you have, your doctor's note, nurse's note, your medication chart, certain checklists that you do, that you use, okay, your passive, your facility round checklist, your patient safety checklist, your OT surgical safety checklist by WHO, those checklists. Consent forms. Very important thing about consent forms. In consent form, you must have a place where you write the risk associated with that particular procedure for any kind of consent that you are taking, whether it is your surgery consent, anesthesia consent, or even LAMA consent. Okay, so whatever risk is there, you need to write it in that risk part. And then you need to have a proper SNDT about the SNDT in the consent. Okay, SNDT is very important in consent. SNDT is very important in everything, but much more important in consent. And then you have other forms, like I said, your nurse's note, OT note, doctor note, medication chart. Many forms are there, endless. Okay, then you have your registers. Okay, in each department you have several registers. I don't need to go deeper into that. I'll just tell you one suggestion. For all the forms and format and all the registers, if you are using paper, then please try to club those registers, those formats. In many cases, I have seen that the hospital staff, they start blaming the quality consultants that after they have come, our documentation has increased. But on the other hand, when we see, they are repeating several registers, they are repeating several forms and formats. Okay, so it is the department in charges. They are in the best position to evaluate those things and then discuss with the quality team, and then try clubbing those forms and formats or registers. Here, similar to the document, you have a concate or concatenate formula. So this way you can code. So here for form, you can have a code of FRM. For REG, for register, it is REG. Here it is REG. Here you can either write FRM or FNF. It's up to you how you do it. It's your hospital, your department. You can play around. But the point is, you need to have proper coding of these documents. And this is basically controlled by the quality team. And all the formats which are implemented, it is highly recommended that you have a control copy. You take signature of the concerned department head and the either the medical superintendent or the CEO or the hospital administrator. You take prior approval of those documents and then you keep it. Okay. Then you have your statutory compliances. Statutory compliances, without these, you'll not be able to apply for NABH. Okay, so legal status of this thing. You have your Shops and Commercial Establishment Act your registration of the business, State Pollution Control Board license, your consent to generate biomedical waste. Then you have your MOU with the BMW collecting agency, your PCB license for water, air, your registration under PCPNDT. If you're conducting medical termination of pregnancy, then MTP Act, as per that registration is required. Then you have your ARB license for X-ray, for mobile X-ray, for dental X-ray, your OPG, CT scan, your mammography, BMD, C-arm, cath lab. Then you have your RSO certificate. Then your nuclear medicine, if you have PET CT, if you have SPET CT, radiotherapy, IMRT, cobalt, LINAC, brachytherapy, narcotic license, pharmacy license. Okay, whatever is applicable. Pharmacy, narcotics, obviously it's widely required. LINAC, brachytherapy, these are very specific. Okay, now let's dive in. So here, your business entities licenses are required. Your shop in different state, it is like your Shop and Commercial Establishment Act license, your trade license, those things are required. All licenses of from your pollution control board, these are required for handling biomedical waste, for generation, for air and water. Everything is required and everything should be updated. If in case your license has expired recently, you can still upload your old license. You also need to upload the application document that we have applied for this license. So that can also be considered for application. Then your PCPNDT Act license. So you have to have a valid license if you are using USG. Okay, PCPNDT is very, very important. MTP, if you are conducting medical termination of pregnancy. So abortion if you're doing, then MTP is required. For ARB, there are several lists. Okay, so for ARB you have for X-ray, whether it is fixed X-ray or mobile X-ray, dental X-ray. Though dental X-ray emits very, very low radiation, which is not harmful, but still, if you have dental X-ray, ARB license is mandatory. Okay, for OPG you required, your CT you require, mammography, BMD, C-arm. A lot of case the OT people, they are not thought about that the licenses for that and the respective staff's TLD badges are also required. In many times I have seen it is missed out. So then we suggest that these compliances needs to be taken care of by getting the certificate. Then for cath lab you are using radiation, so obviously you need RSO license. Then nuclear medicine, you need PET CT, SPET CT, radiotherapy, IMRT, cobalt. So these are all LINAC, brachytherapy. If you are having it, then you require it. In most of the cases, you are using narcotic drugs. So narcotic drug license is very important. and then pharmacy license. So for 3 shifts, you should have 3 pharmacist license, and they must be present there in all time. Okay. MOU. So MOU, first part is the contents. So the parties involved, their names, addresses, their authorized representatives, all party, their signature required. Okay. Then purpose and objectives. So a clear statement of the collaborations, goals, scope, expected outcomes needs to be listed in the MOU. Then responsibilities. So specific roles from each party, their duties, the contribution required, deliverable for each party, timeline you can write here. Then comes the duration and termination. So effective date, term length, and conditions of ending the MOU needs to be written. Certain confidentiality point are also required. So provisions for protecting the shared information should be written there if it is applicable. Then a dispute resolution. So for methods for handling, various methods for handling disagreements after the MOU is being signed, that also needs to be written there. And of course, the signatures from all the parties with witnesses are required. Okay. Then you have the second part. So department which may require MOU. So MOU generally is seen that the housekeeping department, you have MOU with them. Security, it can be kitchen. Okay, certain dialysis, even radiology lab. Even if you have your own radiology and lab, you still may require to have MOU with radiology department that you don't have. You may not have a MRI, so you need to have MRI with other department. For rad peer, you need MOU, even if you have those departments. For lab, say for example, you need to do interlab comparison, you require MOU. Okay. So I hope you have enjoyed this video and you have seen everything till this point. Then thank you so much for watching. So please like, comment, subscribe, and please hit the bell icon to get the first notification. And see you again in the next part of this series of NABH implementation. Thank you.